For the last 20 years, we've been looking for an answer why our children are having difficulties in many aspects of brain function, starting from speech delay up to full autistic spectrum or full autism. And unfortunately, no one could put a finger on the reason why these children are suffering. Why we have all these delays, why we have a dysfunction that cannot be related to any of underlying pathology. For many years, scientists and doctors and dietitians and many family members, they were trying to find a solution for their children problem, but they could not succeed. So coming from this background and being involved deeply for the last 20 years, trying to understand why this happened, why this used to be really a big problem for parents, and the numbers are increasing. Because a few months back we were saying 1 out of 50 has an autism. So I'm very happy today that we have in La Familia Medical Center. I've tried my best to put all these methods together in order to have a unique multidisciplinary approach toward those problems to address the brain function disorders. I call it brain function disorders because in La Familia we don't like to label children. We are avoiding labeling children because by labeling the child we won't get anywhere. We need to address problems. We need to address the ways and the methods of treating those problems rather than just labeling the child and keeping him with one label, and that label won't take us anywhere, as I mentioned. So in order to do so, I have put all methods together, trying to collect all data, all methods, or treatment modalities in the world, and put them all together in order to get a real multi-systematic, multidisciplinary, unique approach to these problems. And what we do in La Familia Medical Center, usually we start by evaluating the child's brain function by doing diagnosis for 3 days. During those 3 days, we do a brain encephalography, and we it's something we call it brain mapping. So we diagnose the areas of low function or increased function. As I mentioned before, we don't label anything, just we address those areas in the brain that have problem, and we work on those problems, whether to suppress the hyperactive area or to stimulate the hypoactive area. And after that, we take it further to the next step where we do sophisticated, detailed lab investigations where we take the urine, the blood, and the stool, and we send them abroad. Usually we send them to the States. And with these lab investigations that allow us really to put a finger on many of those problems who are really being involved and play a major role in causing certain difficulties or certain disorders. And I'll mention some of them. I would say the heavy metal accumulations, the organic acids disorders, bacterial overgrowth in the intestine, the microbiome disturbances, or the quote microbiome abnormalities, overgrowth of fungi and bacteria. So we have a special system to clear up the gut, to get rid of the heavy metals accumulation and to treat the bacterial overgrowth. And we use another technology or technique, or I would say modality of treatment, where we use the ozone therapy. And this is a very special method of treatment where with the help of ozone therapy, we can clear and treat lots of these problems. So put all these methods together, plus the complementary services that we have to complement the basic and the basis of this treatment. We have a speech therapy, we have occupational therapy, we have the physiotherapy. So we have all these complementary services put aside with the basis of the treatment where we address the core of the problem. So I'm really happy and honored. And I have finally, not me, just all of us, finally we have a hope to do something for these children to improve their quality of life and their parents' quality of life. So we're talking about fixing and treating and improving families' lives by using and implementing this multidisciplinary approach. I'm so happy that I'm part of this journey. I'm so proud of my team. I'm so proud of the doctors that are working with us, because we already have on board doctors from multi-specialties from many countries arrived specially to work with us in La Familia Medical Centers with a huge experience in dealing with kids with brain function disorders, more than 20 years. So put all this together, I'm full of hope that we can make a change. Believe in us. We believe that we can help. Thank you.